Hello, everyone, and good evening. My name is Claudia de la Cruz, and I am with the People's Forum in New York City. The People's Forum is a community organization committed to advancing the struggles of the working class, the poor, and the dispossessed in the United States and internationally. We organize and host a variety of political education and cultural events with the aim of deepening our people's class consciousness and building the unity amongst our movements to achieve systemic transformation. And this evening, we are so honored to host and collaborate with our comrades from BRADO, New York, from Coletivo Reconvexo, and Mujeres de Resistência no Exterior in organizing this virtual event on the impact of the pandemic in Brazil. It is important for us to continue to have conversations on the ravaging effects of a global health crisis that continues to disproportionately impact the poorest and historically marginalized communities around the world. And it's particularly important to speak about it in a moment where little is being said about the hoarding of vaccines by the wealthiest countries, the disproportionate distribution of vaccines, and the state neglect that is resulting in the desperate situation of the many all around the world. We know the root for the deep, multi-layered crisis that we are experiencing today as a working class is based and is rooted in global capitalist systems. What COVID has done is uncover the inequality and contradictions of a system that prioritizes profit over people. And again, we're honored to be partnered with our comrades for the invitation to doctors Luiza Nassif and Pablo Valente to speak with us on the current situation in Brazil. We want to encourage folks to please make sure to share and support the US Brazil COVID relief campaign. People to people solidarity has been what has sustained our communities for hundreds of years. It has guaranteed our survival as we strive and work to reach systematic transformation. And so we want to thank you all for joining us tonight. And we want to again encourage you to continue to learn about what's happening not only in Brazil, but around the world with relationship to, again, the multi-layered crisis that we're experiencing as the working class, the poor and dispossessed. And I want to pass it on to Clara, who will be facilitating this great discussion. Thank you.
Thank you so much, Claudia, and thank you, the People Forum, for giving us this space to make this very important discussion that is not only, as Claudia mentioned, the fundraising campaign kind of divulgation, but also this necessity to discuss and to show the things that are going on, especially in Brazil, that we are going to discuss today during this pandemic. And as the New York Times said, in Brazilian case, it's not only the COVID pandemic, but also a hunger pandemic that's facing. And that's exactly what led us to come with this campaign to collect funds. So I'm from the New School with a member of Reconvexo collective, and together with BRADO and Mulheres da Resistência, as Claudia mentioned, we built up this campaign, and we are going to help 5 institutions from Brazil who are aiming to fight this hunger and this food insecurity. So right now we have more than 100 million children and adults living under food insecurity in Brazil. And as the panelists will probably talk about, we don't have a lot of aid from the government, monetary or donations and things like this. So we need to make those type of solidarity people to people, as Claudia mentioned. So I'm just going to say the names of the institutions that we are helping here. At our fundraising page at GoFundMe, there are the websites and Instagrams and etc. of those institutions. So for everyone who wants to check it out, you can go there and see it. And please, of course, donate and help us here. So the institutions are Ser Ponte, Campanha de Enfrentamento à Fome, Instituto Cidadão, Fórum da Amazônia Oriental, Rede de Arrecadação Solidária de Campinas e Comunidade Indígenas do Carajás. So, of course, those are Brazilian institutions, but you can check their websites and, again, their social medias, okay? Right now, I'm going to introduce then our panelists. So first, we have Pablo Valente, who is an infectious disease physician and public health researcher at Brown University. And then we will talk to Luiza Nassif, who is a researcher at the Levy Economic Institute of Bard College and Ph.D. economics at the New School. So before just passing the word to Pablo, I just want to again reinforce this really hard and actual horrible situation we're living in the pandemic in Brazil. We are the second one in number of deaths, and I just looked the most recent numbers here. So we have already 17.5 million cases and 491,000 deaths in Brazil. So we are reaching near 500 deaths, 500 million thousand deaths, sorry. So we need to, this is really urgent and we need to talk about this. So now I'm going to pass the word to Pablo to talk a little bit.
Hi, thank you very much for the introduction. I'm very happy to be here having this important conversation. I think it's sad in a way that we need to be having those conversations in a moment where just this week, New York changed the restrictions as far as coronavirus here in the state, and other states are following the same kind of measures. Other countries have been loosening up restrictions, and in Brazil, the situation is as bad as it was a month ago, 6 months ago at the beginning of the pandemic. So it's really with a lot of anger and a lot of frustration that I'm here, but it's still, I think it's very important that we talk about it, not only to talk about the campaign, but also to get more people informed about the situation in Brazil and about what we can do to kind of try to change things around. So as you said, Brazil right now has almost 500,000 deaths related to the coronavirus so far. Each day there are more than 2,000 people dying, and still we've had the worst moment of the pandemic about a month and a half ago, but still cases are very high in number. So we have 65,000 cases a day in Brazil, and we have 2,400 deaths a day. And the more cases you have, the more likely it is that a new variant can emerge that can compromise vaccine effectiveness, or can make people who are immune or partially immune more vulnerable to getting the disease in more severe form. So Brazil right now, it's not a situation, the situation of coronavirus in Brazil doesn't only matter for Brazilians or for people who are connected to Brazil somehow, but it matters to the world. Brazil is one of the hotspots of coronavirus transmission in Brazil, posing great social and health suffering to the population in Brazil especially, but posing threat to the entire world. And I think it's important for us to try to think about some of the causes of the situation in Brazil as it is now. Brazil has because Brazil is a very big country, you have many regions, so it's hard to control a pandemic in a country like Brazil. Other countries of similar size have struggled as well. We also have a very big population, so we have a lot of people to be taken care of, and that creates some challenges as well. But also we have this great strength, which is our public health system. When we think about public health system or a healthcare system, the first thing that comes to mind to most people is something related to healthcare systems. So you being able to go to a hospital and not having to pay a bill afterwards. But a healthcare system is much more than that. Healthcare system helps structure the whole health infrastructure that is needed to handle a pandemic like this. For example, Brazil's public health system, SUS, helps structure research around health-related issues in Brazil, helps us create capacity and infrastructure for testing, which is also necessary for the coronavirus, and structure surveillance systems and so forth. So the reach of a public health system like SUS is in Brazil is very important and should have put Brazil in a position to be handling this pandemic relatively well. I think no country had it easy, but Brazil was well positioned to be handling this well, but we didn't. Right now, we're the second, as Clara said, we're the second country in terms of deaths, and we're still like this ongoing struggle with the coronavirus, while other countries have been releasing restrictions. And I think it's very important for us to talk about the role of Brazil's president, Jair Bolsonaro, in the crisis. I think there are two main things. I think there are many things that Bolsonaro has done to undermine Brazil's response to the pandemic. I think it can be summarized into two main things. The first one is his long-standing attacks against Brazil's public health system. Shrinking funding, disputing any kind of technological advancements in Brazil, disputing the work that was being done in universities. So this kind of political thing that permeates Bolsonaro's trajectory as a congressperson and then as a president put Brazil in a situation where we didn't have the tools that we would hope to have to deal with the pandemic. But more than that, and I think in a more deliberate and way, Bolsonaro undermined the response to the pandemic in any way that he could. And a way to kind of to summarize his response to the pandemic was his defense of the herd immunity as a strategy. And Brazil's been talking a lot about the herd immunity as a strategy in the Senate in Brazil now, as we're having this parliamentary investigation committee. So what Bolsonaro put forth in Brazil was the idea that we didn't need to do anything to curb the transmission of coronavirus, because we would, if we got everybody infected in a fast enough way, we would reach this stage of herd immunity, and then transmission wouldn't be able to go on anymore, and the epidemic would die down. And that's, first of all, herd immunity, I don't know if everybody's familiar with that. Herd immunity is a point where you reach a situation where there's a large number of people that are immune in a community, in a society, and then transmission it can take place, but epidemic outbursts are difficult to happen. So the number of cases tend to decrease over time and not increase over time. But herd immunity is not a public health strategy. Herd immunity is a consequence of other public health strategies. Usually, this concept has been developed in the context of vaccines. So herd immunity is the number of people that you need to get vaccinated. So people who are not vaccinated in the community are also protected by those who are vaccinated. Herd immunity is not a strategy that you employ to let transmission take place naturally without the vaccine. First of all, because if you do that, in the best case scenario, after a lot of people get infected, a lot of people will die of it, and you may end up getting in a place where a lot of people are immune. But then, as a result of this, increased transmission, a lot of people will be hospitalized, will have severe forms of the disease, and will die. So, and of course, we don't want that. A regular president wouldn't want that, different than Bolsonaro. But the second thing is that coronavirus in particular is not a virus that is conducive to this kind of strategy, because we know that people can get reinfected with the coronavirus, especially if they get a natural infection as opposed to the vaccine. So since we know that people can get reinfected more than once, more than twice, even 3 times, we know already, perhaps more than that, then the strategy of herd immunity is not going to work. And Bolsonaro, knowing all of this, it was not ignorance, was something deliberate to cause harm and to exculpate him, to take the responsibility out of him and put in other parties. We reached the situation where the things are really bad in Brazil. So the ways he pushed for her immunity was, first of all, pushing for early treatments that do not work. So instead of focusing his attention on rolling out the vaccine program or developing new vaccines or rolling out the testing program, he was defending these treatments that we know now and we knew then that didn't work. So it's a waste of resources, and you create confusion in the minds of people who are getting public health messaging from the government. The other thing is to create confusion in how the messages related to mask wearing, related to social distancing, were communicated to people. As governors and us as other public health experts, we're talking about the importance of masks, the importance of avoiding crowds, avoiding practicing social distancing. Bolsonaro was undermining those very messages at all opportunities he had. And also, by not giving, and I think Luiza is going to talk more about this, by not giving people the conditions, the support they need, the resources people need to avoid crowds, to avoid, to stay at home if they can, to work from home if they can, by not giving people emergency relief or other safety net measures, they push people, Bolsonaro pushed people to go out to the streets and get infected and continue the transmission of coronavirus. So I think Bolsonaro has a very direct responsibility. I think the Senate in Brazil is reaching the same conclusion now as the investigation unfolds. And I hope that one day he will be criminally liable for what he did. But perhaps, so we've been talking so far about the role of Bolsonaro and how we ended up where we are now. But perhaps more important than that is to talk about what we can do to change the situation, to turn things around in Brazil. I think one thing that is very important that we work on, I think at the government level, we know what needs to be done. We need a government that communicates clearly that people need to be wearing masks when they're with other people, especially in indoor places. We need the government communicating that people need to avoid crowds if they can. But more than that, we need a government that gives people the resources so they can practice those measures. So give people access to masks if they don't, and access to other forms of income to replace the income that they're not making, the livelihood that they're not making by staying at home. So that's number one. So we need the emergency relief, auxílio emergencial in Brazil. More than that, we need the government who here in the United States, we don't talk a lot about testing anymore, but in Brazil, since transmission is so high in Brazil, it's very important that we continue to develop our testing capacity. Right now, Brazil has stalled in time. Things are not as bad as they were at the beginning of last year, but still many people don't have as easy access to testing as they should. Some people have to pay out-of-pocket costs, and people are taking the wrong tests. And that's part of it is because the federal government has not helped the states to organize a testing program and get tests to people who need them. So that's the second thing. And perhaps now the most important thing is that Brazil, the government should be doing is to make up for the time loss and be really invested and engaging Brazil in a vaccination program to speed up things in Brazil. Right now in the United States, we have about half of the people who are at least partially vaccinated. More than that, in many states, much more than that. And in Brazil right now, we have only 10% of the people who are fully vaccinated in Brazil. So until we get to that point where people have a nice, a good vaccine coverage, ideally over 50%, ideally over 66%, which is a number that we know would help curb transmission even among people who are not vaccinated, it will be very hard for us to stop transmission, to stop deaths, and to reopen the country so people can get back to their normal lives. So those are three things that the government should be doing, and we know that. But what can we do as civil society, as movements, as individuals to push Brazil in that direction? I think one thing that we can do, which is part of the reason why we're having this transmission, is engage in the donation programs. There are many donation programs that are going on. I think this one in particular that is being organized by BRADO, Reconvexo, and Mulheres na Resistência is a very solid one. It's gathering money to distribute to organizations in Brazil, organizations that have done longstanding work with many communities in different situations, all of them in very high, in situations of very high vulnerability. So that's one thing that we can do that is within the reach of many of us, to donate and to engage in those community building and community donation programs. Besides that, or as we do that, I think it's also very important that we engage and that we understand that Bolsonaro is one of the main responsibles for getting Brazil where Brazil is. And there will be no lasting solution, no effective solution to the coronavirus crisis in Brazil with Bolsonaro in power. I think it's very important that we, as we understand the situation as it is in Brazil, that we engage ourselves in our fight against Bolsonaro and Bolsonaro's policies. So 3 weeks, and I think Brazil has started to realize that. 2 or 3 weeks ago, there were over 500,000 people took to the streets in Brazil to protest against Bolsonaro. And we have new protests coming up this Saturday all over the world. Here in the United States, we have at least 3 sites who will be having protests, including in New York at Union Square, in Boston, where I am as well. And I think Florida too, and other places also. So I think, and besides that, there are many cities in Brazil, over 240 sites in Brazil who are protesting against Bolsonaro. Because I think people have realized that with Bolsonaro in power, there is no solution to this crisis. Bolsonaro is going to keep working against public health measures, against the work of the few states that have been doing good work to solve the pandemic. And until we get him out, situation in Brazil is likely not going to look up, and we need to see this end of the tunnel. And the only way to get there is to get Bolsonaro out. And we cannot wait until next year when we have the election, 2022. We are hoping to elect another person to take office, but we cannot wait until 2022. We need to do it now. And the way to do this now, as movements have been realizing, is to take to the streets and protest against Bolsonaro and his policies. So I think I'm going to stop here. I'm not going to take too much time more, and I'm open to answering questions and continue discussion later on. Thank you.
Thank you so much. That was great. And I just want to reinforce what Pablo said, that unfortunately right now we can't, we have to rely on individual actions to try to at least help some people who are suffering with this pandemic. So I'd like to reinforce our COVID relief fundraising campaign. That is the initiative that 3 Brazilian collectives at New York are doing to donate some funds to 5 institutions to fight hunger and food insecurity in Brazil. Because as Luiza will probably talk about, we know that also the COVID is being spread in Brazil, as Pablo mentioned, but the impact is not equal for everyone in the society, and it is actually really unequal. So we do need to help the people that's in need. And we, as we mentioned in the beginning of this transmission, there's a lot of people facing food insecurity right now. So please donate to our campaign. And now I will pass to Luiza, and after she talks, we will have a Q&A session. So you're free to send questions, either if you're here on Zoom or on YouTube. I can also look at questions over there, okay? Thank you. So Luiza, please.
Thank you so much, Clara. Thank you for the invitation, for Reconvexo, BRADO, and Mulheres da Resistência for organizing this event and the fundraising, and for Pablo for his great talk, and for People's Forum for hosting the event and giving us this amazing platform. It's such an amazing space in New York, and I'm great to be here virtually back at People's Forum from Brazil now. So I will share my screen. I know we've been all looking a lot at slides, but I do have some data that I want to share with you. And I apologize, I'm in a very quiet loud place, but my windows are closed. This is just traffic in Rio de Janeiro right now. The city is going on as usual. So I'm going to start with a very quick New York example, because I think this resonates a lot with New Yorkers, and they understand. Actually, it's a Brooklyn Queens example. So there was a New York Times piece that came last year after the antibody tests started running around that showed that the positive antibody test percentage in Corona Queens was extremely high, and in Brooklyn Heights was extremely low. And actually in Corona Queens, we saw that it was the worst of the first wave. And then the hope was that that Corona Queens would have reached herd immunity at that point. But actually what happened is that Corona Queens was again one of the worst hit neighborhoods on the second wave of COVID. And this is data from February. Now I hope things are a little better because vaccination really started fasting. But at that point, we had 10% of Brooklyn Heights fully vaccinated, while only 3% of Corona Queens. And you can see that there is a huge difference in terms of income of those places, in terms of race, in terms of non-citizenship, and also on health insurance. So there's all these layers, these background layers of inequality that translate itself in terms of COVID, with people dying more or dying less in certain areas. And this is a micro example of areas that you know within, they are 9 miles away from each other, Brooklyn Heights and Corona Queens, and you still have these huge differences. So now think of the global scale. So when you're talking about this reality to a global scale, the macro inequalities that we're talking about are much bigger, and therefore this many small aspects end up contributing and adding to each other. So basically, we can think of 2 different impacts that COVID has had. One, of course, is health impacts, and the second one is economic impacts. And I'm gonna detangle the 2 of them separately. And the unequal health impacts, they themselves have a socioeconomic background to them, because the vulnerability to contamination, the existence of pre-existing conditions such as comorbidities, the health access, and institutional racism and health treatment, they all play a role in leading to higher or lower health impacts to different people. So in terms of vulnerability to contamination, working conditions, so for example, if you need to travel, the mode of transportation, what type of occupation, if you're working remotely, what is your work environment in case you cannot work from home, are you working on a closed space, near people? And then there's also, of course, other living conditions that play a role. So access to water, sewage system, how many people you live with, how many people live in the same dwelling as you, or in a big building sharing common spaces, and who you live with and what are your responsibilities at home. So you see a lot of women that take care of other people that have been more exposed to COVID because of that. And also, of course, what is your capacity to avoid risks in terms of economic vulnerabilities? So do you have dependents? If you have dependents, you might not be able to say no to a risky job because you need people to survive and people depend on you. Do you have access to certain goods and services? Do you have savings and wealth, or do you need to go to the market daily? You need to search for food, you need to search for goods. And do you have access to labor rights or not? Are you going to work even when you're sick because you cannot avoid? So all of those things, they play a role in explaining higher contamination rates in different states in Brazil. So this is a work I did with Laura Carvalho and Eduardo Ravetti, using data from PNAD, which is the household survey in Brazil. We used the one from 2019, and we also used some data from a COVID survey that they've been doing, and we compared that with COVID data, cases and deaths. And basically what we find, we create a social vulnerability type of measure, or kind of an index, taking into consideration this working, living, and mobility conditions of people. And we create an index, and we see that it's correlated by state with deaths and cases. So our index helps explain the actual observed case rate and death rate by state. And then we look into race and gender, and we see that actually white people are below average. So the average index in Brazil, vulnerability index for all races and all genders, is 1.53. And we see that white men and women are below average, while Black men and women and brown and indigenous are all above average, so have a higher vulnerability to contamination. Asian people also have a lower vulnerability index. So we also look into groups by income, because one of the issues we have in Brazil, similar to the US, is that income inequality is very correlated to race inequality. So we wanted to see if the vulnerability was just being expressed because of an underlying economic inequality, or if there is something about race itself that explains vulnerability even within the same group. And actually, we can see that the white population escaped the vulnerability average at the fourth quintile, while Black and brown population only escaped it on the sixth quintile. And we see the same thing when we look into education level. It's not about the education. So white folks from all education levels are below national average, while Black and brown folks up to high school completed are above the national average. So only in average, those with secondary, incomplete, and complete with a higher education have the ability to escape vulnerability to contamination in Brazil, and they are Black and brown. The other aspect of the unequal health impacts has to do with previous health situations. So what we've been talking about as we've been calling comorbidities, which became a very known word to all of us. So there are certain conditions that are determinant on health outcomes, and certain factors, socioeconomic factors, that are previous to this pandemic that help explain why we observe an unequal distribution of comorbidities within people. So stress, pollution, diet, limited health access for an extended period of time explains why, in part, poor population are more likely to have diabetes, pulmonary diseases, asthma, and certain chronic diseases that help explain a higher contamination rate and a higher likelihood of dying from COVID if exposed to the virus. And using data from the Brazilian the Brazilian Health Survey, we see that by education level, there's a huge correlation between the proportion of population that have some health risk or multiple health risks compared to people that have high school completed and a graduate degree or higher. And this is even considering the fact that the health survey actually asks you, have you ever been diagnosed with diabetes by a doctor? So actually the likelihood, if you are at a lower level of income, or if you live in a more restricted, in a more secluded area in the country, it's less likely that you have been diagnosed with a disease, even if you have it. And we use education level with this survey because the data on income is not that good. So that was the best proxy we had to reflect certain inequality here. And then the other thing about Brazil, Pablo has already explained a bit of our system very well, but one thing to know about Brazil is that we actually have two parallel systems running. We have our amazing public system called SUS, which is more and more being being less and less funded and more used or needed, so to say. And actually, there is also a divide between the races that depend on the public hospitals and the race that depend on, that uses health insurance and therefore uses a private hospital or private system. So the amount of beds, for example, the amount of UTI beds that we have in both systems is exactly the same, it's about the same. But the public system serves 70% of our population, while the private system only serves 30% of our population. And this is also racialized. So Black and brown population depends much more widely on the public hospital than white population. Now I'm going to shift gears a little bit and discuss the Auxílio Emergencial. So the Auxílio Emergencial is the benefits that Brazil have implemented in April last year. It has installed monthly transfers and replaced the Bolsa Familia for the most low-income families. So people that were already receiving Bolsa Familia started receiving Auxílio Emergencial because that was higher. If the Auxílio Emergencial was a higher value than Bolsa Familia, you automatically transferred and received the Auxílio Emergencial. But the Auxílio Emergencial serves a much bigger amount of people than Bolsa Familia. In 2020, we had 5 installments of 600 reais and 4 installments of 300. So it went from April through August with the highest level. And then from September to December was decreased by half. Single mothers who were heads of household received double the amount. So in the first round, $1,200, in the second round, $600. And then in 2021, for starting from January, February, and March, there was no Auxílio Emergencial, which also here EB's emergency benefits. And then it was reduced to 250 on average, going from 150 to 375, depending on the family composition. And it was originally approved only from April through July, and it has been announced by Guedes 2 days ago that it go through September, but it's not officialized yet, as far as I understood. So this is brand new. But basically, and this is still from the first paper with Carvalho and Ravetti, we see that the Auxílio Emergencial was extremely important to decreasing inequality in Brazil to lower levels than actually the pre-pandemic level. But that without the Auxílio Emergencial, we would have seen an increase in inequality, because it actually is on the lowest, in the lowest part of the income level. People have lost proportionally more income than at the higher level. But the Auxílio Emergencial has been benefiting mostly low-income population. And the other thing that we observe is that Auxílio Emergencial has been able to decrease inequality among race and gender lines. So here, what we observe is that before the pandemic, a household that was headed by a white man had 2.5 times in the income of a per capita income of the household that is headed by a Black female. And with Auxílio Emergencial, this decreased to 2 times higher, which is still extremely high comparatively. But what we would have seen without Auxílio Emergencial, and this is what's so worrying about this year now with the lower levels of Auxílio Emergencial, is that what Black and brown women-headed households have lost more income between the pre-crisis and May, have recovered less because there has been already a recovery last year, and they have recovered less and depend even more on Auxílio Emergencial. So the very last set of data I'm going to show you is some simulation using the new value of Auxílio Emergencial and without the Auxílio Emergencial, to see what happened to the poverty rate in Brazil. So the poverty rate actually decreased a lot, and extremely poverty rate as well. And we've seen a closing in the gap between men and women. But the new Auxílio Emergencial does not, it almost closes the extreme poverty gap, but does not close the men and women poverty gap poverty, only extreme poverty, sorry. And when we look into by group, the poverty rate among Black women is gonna get, without auxílio emergencial, would have gotten to 41% of Black women living in poverty with less than $550 per day. And with the new auxílio emergencial, it's still 38% of Black women living in poverty. And the extreme poverty rate is also extremely high. And this is people living with less than $1.9 per day. And it would have been 15% of Black women living in poverty. And it is actually 12.3% according to our simulations with the new round of auxílio emergencial. And as you can see, really the greatest divide that we see in Brazil is not really you do see a divide in gender when you look into Black women and Black men, but there's not as much of a divide when you look into white women versus white men in terms of poverty and extreme poverty rate. Or a great divide, the abysm that we see in Brazil, and that no level of policy implemented during COVID has been able to solve, and actually during COVID it has gotten worse, is the racial divide that we see in our country. And just to end, the reason why we should all care, and Pablo already mentioned that, is because we are observing new variants, and as it is, I don't know, there's something about the population in the US, especially. I just moved back from New York to Brazil 3 days ago. And there is something about the reopening of New York and this feeling that we have that we're back to normal, that somehow is not getting across to people that we are all in this together. So there is no border, even though the borders are getting bigger and bigger in kind of more practical sense. There's no physical border for the virus. So the more Brazil keeps reproducing the virus, the more likely it is that a new variant is going to come up, and then it's going to create a problem for vaccination all over the world. And what we see is that the global north, so this is share of population fully vaccinated, the darker colors means more vaccinated, and this is the reproduction rate. So anything yellow or warmer colors here means that those countries are with an infection rate above 1, which means that the virus is spreading faster so it's not dying out. So there is no reaching herd immunity on those places yet. And those are the places that have not been vaccinated yet. So there really needs to be some kind of global coordination to get vaccination across the world. I think I went a bit too long. I'm so sorry.
No, that's okay. That was perfect, actually. Thank you so much, Luiza. That was great. You actually almost answered the question I was going to ask Pablo about, but I think I'm going to ask anyway, and I also have a question for you to answer later. And again, everyone who is watching us on YouTube or here on Zoom can ask questions as well, and I will pass to them your questions. And remember, we have a COVID relief fundraising going on. That's super important, and that's actually the initiative that brought us here today. So actually, I'm going to read a question we had here on the chat before I ask my question. Okay, so for both panelists, what are some of the challenges organizers are facing in Brazil? And on the flip side, what are some of the ground projects folks should know about and follow in Brazil? So I think I will pass then the word to either of you who want to answer, or both. I don't know if someone wants to go first. Pablo, maybe. Luiza already unmuted.
Yeah, I'll go first, and then yeah. So I think it's a very good question. I think one of the challenges organizers have been facing, I think We've been, in Brazil, we've been focusing a lot on the role of Bolsonaro denying science and denying public health measures and everything. But there's another narrative that is being disseminated by right-wing governors in Brazil and presidents around the world, in France, Colombia, Chile, is that COVID is a threat to us all, is a common enemy that we need to fight together, and everybody's making compromises, and everybody needs to do their share so we can defeat this enemy. And I think, so besides Bolsonaro denying everything, I think this is the second narrative has penetrated the ranks of many of social movements and organizers. So a lot of people were a little bit reticent about taking to the streets, about protesting against Bolsonaro, because of this idea that we cannot be doing this right now. We need to be at home, and any kind of protest is dangerous at this time. And I think this narrative is a falsehood for once. First of all, COVID, as Luiza has said, COVID has not affected us all equally. I think that the burden of COVID and the economic and the health burden of COVID is not shared evenly across, social groups, across race and ethnicity, across gender, and across wealth status. So it is not true that COVID is a common enemy. COVID is affecting poor people and Black people much harder than it is affecting richer people. So that's part of the falsehood. And the other part is that everybody's doing compromises, and that we cannot ask for anything, and right now we cannot have demands because everybody's doing their best. And that's not true either. There's a lot of things that need to be done, even in Brazil or other countries. They're not being done. And I think the only way to do this is protesting and demanding our rights. So I think it's very important. I think it took us a while to realize that, but I think Brazil is on the right path, organizing these mass protests. And I think there's a safe way to be doing those protests, with social distancing, with wearing masks during the activities, hand sanitizers and everything. And we showed here in the United States last year, after George Floyd was murdered, there were millions of people on the street, and COVID cases did not increase because of the protests. So there is a safe way to do this, and Brazil is doing that. So that's one thing. It's kind of like the flip side of the question. And the other thing is support the work of the organizations that have been doing this person-to-person work, this community work, getting resources directly to people who need them. I think BRADO, Reconvexo, and Mulheres na Resistência is doing that already. I think a good way that they're doing this is partnering with organizations that are already on the ground doing this work. So I really encourage everybody to be donating to this initiative as well, in addition to be protesting this Saturday, either in Brazil or abroad. Most countries in the world are not most countries, but at least 40 protests have been organized around the world to protest against Bolsonaro and in defense of public health.
Thank you. Luiza, do you want to say something?
Yeah, one thing I'm going to add to the timing of the protest. I think it's very important that we are protesting right now, as there is some economic impacts that have been affecting Brazil, which is good on the one hand, because things are getting a little better. So we've just observed a small change in the exchange rate, so dollar has gone down a little bit. We also observed an increase in commodity prices, which has helped Brazil already a little. GDP started growing again. It's not really the best type of growth we want to see. That doesn't get really well shared. It's not creating the type of jobs we need to create necessarily, but it is a relief in the sense of also the population suddenly believing that the government might have done something to them. So Bolsonaro has been trying to claim that first, that Auxílio Emergencial, Bolsonaro and Guedes have been trying to claim that Auxílio Emergencial was their biggest program and it's done amazing. And it was not them that did this. This was passed through a process of the Congress against their own will. And also now Bolsonaro, it's a good thing, he's now finally talking about vaccination for the very first time, but at the same time trying to claim as if he's the one that created vaccination, while what we know is that they try to do everything to hinder our capacity of vaccinating. Brazil could have been much, much further away in vaccination. But this does not reach population necessarily. So I think what is the hardest part of actually getting, that organizers getting Brazil is misinformation, is fake news, is really, this makes it extremely hard to organize, I think, these days. In terms of projects, I think Clara could answer that, because some of the projects that the fundraiser is supporting are amazing. One that I'm going to mention is Coletivo Papo Reto in Rio de Janeiro, who is a very great, amazing group. Work mostly, they are in the Complexo do Alemão, which is a big favela in Rio, and they do a lot of amazing work on racial inequality in Rio. But I think Clara could answer some of that as well.
Yeah, sure. I think I agree. Papo Reto is a great initiative, and also the ones we are helping here. There are some that are smaller, some that are bigger, but I think any initiative that is in this type of line is worth helping. In addition to those ones, I know that the PT, our Labor Party from Brazil, is also organizing something together with PSOL here in São Paulo, where I am. So I have some friends that are involved in this as well. I think I'm trying to remember the name. But I won't remember the name right now, but I can post to send to the People's Forum somehow. But yeah, I think we are reaching the end, and there's one question from YouTube and one question from me. So I think we can answer those questions, and maybe we will reach our time. Okay. So I had a question for Luiza, actually, related to the impact of the pandemic on inequality, because we know that the pandemic has reached people differently because of the inequality we already had. But I was wondering, especially racial and also gender inequality, if the pandemic will have a huge impact, and if, like, how will we leave this pandemic looking like? Would that be too hard? I know it would be worst, but would it be like too horrible, and we will take a bunch of time to recover in terms of inequality or something like this? And I think the one from YouTube, Luiza and Pablo can answer this one. So what does it take politically to vaccinate most or all of the world population, and what would be a realistic timeline for that to happen? So I think now I'll pass to Luiza and Pablo, and I think that together with your answers, you can also make your final, say your final words or something like this, okay?
So, well, it's very hard to answer the question about what will be inequality like after. I think it is going to be very bad. This is the main reason why we've been pushing so much for the continuation of auxílio emergencial and for the implementation of actually the full amount that was implemented last year. It's because the pandemic is not over yet. It's actually at one of its worst time, and then that's the time that they decided to actually decrease this and use this idea that as if the economic crisis is not the result of the pandemic and the sanitary crisis itself, but as if the economic crisis is actually the result of lockdown policies or of panic or something like that. So this is something that Bolsonaro has spread within Brazilians as well. And this is why we see so many people on the street still. It's just that he has forced people individually to make a health choice over an economic choice. So in a macro sense, this idea that there is a trade-off between economy and health is absolutely wrong. This is just false. But when you get to a micro level, when you get to people that need to decide every single day to expose themselves or to survive and to have a paycheck, they are facing that decision. So this is one of those composition fallacies that we talk so much about in economics. But in terms of gender and race inequality, they, as I mentioned, last year, what we observed with the data from the COVID household surveys, that it actually decreased, but that's because of auxílio emergencial. Whenever you take out the auxílio emergencial and look into that data, it would have increased a lot, exactly in terms of race and gender lines. So it's hard to tell what's going to come up next. It's extremely hard to tell because yes, the economic impact on women, Black and brown population has been harder. And also the recovery for those population is slower. The jobs that come back, they come back in different areas. So service areas, for example, they've been extremely hardly hit. And this is very gender occupations. So I think it depends on what we do next, but there has been no policies to really help. The only policy that helped was auxílio emergencial. There has been no gender and race specific policies implemented during COVID. And the other question was about, well, I'm just gonna say one obvious thing, which is break the patents. How long it's gonna take? I think it's gonna take a while because it also would take the world to have less nationalistic and individualistic feelings, and that's I don't know. It's just exposing the worst of us, and I don't see us changing culture in a timeline that will actually get the population of the world vaccinated. But thank you so much, and yeah, Pablo.
Yeah, no, thank you. I would like to thank you, the organizers, the People's Forum, the BRADO, Reconvexo, Mulheres, Resistência, Clara and Luiza. I think I've learned a lot in this conversation. I think it's an important conversation to have at this moment where, as Luiza said, there's this idea in the United States, at least on the East Coast, that things are getting back to normal, but around the world, things are not close to being getting to normal. And there's still a lot of work that needs to be done. And I think there's still a lot of things that can be done, at the government level or at the civil society level, at the social movements level, to move the needle. So as to respond, like the hard question about the vaccinations, I don't think there's an answer for that, because I think that the situation, the rollout of the vaccines is very unequal across countries, very unequal within countries. And I don't think there's a perspective, like a short-term perspective by the end of this year to get most of the world vaccinated. Talking specifically about Brazil, I think there are some expectations that by the end of the year, we will have, a relatively good vaccine coverage, but I would like to stress that this is very slow. Considering, the health infrastructure that Brazil have, the capacity that Brazil has to deliver vaccines, to be waiting over 1 year since the approval of the first vaccines, to have, 50, 60% of the population covered by vaccines. I think it's a long time, and along the way, a lot of unnecessary deaths have occurred and will occur still. So I think those are the estimates that people are been talking about in Brazil. It varies state by state, but I think by the end of the year, it seems that as rich countries get their vaccines, there is some kind of surplus of vaccines that then can be shifted to other countries. Of course, it takes political commitment of the governments, and Brazil lacks that. Also takes economic means as well. And I think one of the things that I think I agree with Luiza, I think it's the patents are important to be discussed, but I think the solution needs to go much beyond that. I think it's very important that we develop the kind of health infrastructure and strengthening health systems to actually, if we get a surplus of vaccine, that we can distribute that in an equity-oriented kind of way and in the fastest way possible. And we won't be able, like, vaccines are not enough if you don't have qualified health workers, if you don't have well-paid health workers, if you don't have services that reach people in rural areas and indigenous communities and so forth. So I think there's a long way to go. And I think this strengthening of health and education systems, it can prevent that in the future we have this disparity. So it's not an accident that most of the vaccines that have been distributed have been produced in the US or in Europe. This is not an accident. This was created by design of the inequality across countries that has technology developments happening in some countries while other countries don't have it or have to purchase it at a higher price. So I think we need to restructure the system so we have a sustainable solution to that and to future pandemics that happen. And I think I would like to end just kind of reiterating, I think, the lesson that Luiza has taught us, that I think inequalities are key to understanding the coronavirus and the effects of coronavirus in Brazil and in the world. In public health, that there's something that people call the double burden or the triple burden of disease, that poor communities, they have a higher degree, a higher rate of infectious diseases and chronic diseases and violence-related morbidity and mortality. And I think the coronavirus situation has taught us that this still holds true, and it's truer than ever now. So poverty, it creates the conditions for epidemic spread. It creates the conditions, crowding and the kind of jobs that people do and the kind of lack of support for people not to stay at home and everything. But so it's a vicious cycle in that poverty creates pandemics and pandemics create poverty. And that unless we kind of disrupt the system and create like new forms of making health and treating health conditions and pandemics that arise, future pandemics will still be reinforcing disparities and inequity around the world. So I think if we can learn this lesson, both in the academic community and the movements and social movements, and etc., I think it will be a little bit of a silver lining from this situation. But I think it's hard to be talking about silver lining in a moment where situation is so bad in Brazil. And as we said, I think if I were to be ending with one message, I think the message would be for people who are interested in Brazil, for people who are worried about the situation in Brazil, to be engaged in the protests that are going to be taking place this week and the ones in the future as well. Thank you very much.
Thank you so much, Pablo and Luiza, for accepting our invitation to talk today. I really liked it. I learned a lot. And I just wanted to reinforce what all of you said. Let's just end this knowing that we need to stay in solidarity with each other. And also, we desperately need to take Bolsonaro out of power and to take action in this direction. So thank you so much, everyone. Please, if you can, donate to our campaign. That's really important, and that makes a lot of difference for us here in Brazil as well. Thank you. Thank you.
Thank you so much, Clara and Pablo and the People's Forum for organizing.
Yeah, thank you for the space, the People's Forum.